Thanks for staying with us here on The Real Story. Back to school season means a focus on student supports and family needs, from community leadership to the state capitol and Capitol Hill. We're sitting down with a leader from the Village for Children and Families to talk about what's working and what's still needed. Here with us now in studio, Dr. Laine Taylor, Chief Medical Officer with the Village. Thank you so much for being here.
Thank you so much for having me.
So I know the Village provides support and services year-round, but obviously, during back to school, this is all highlighted. Just to get a lay of the land here, right now, still post-pandemic, families are facing new social, emotional, and financial challenges. What are you all seeing as the biggest gaps that still need addressing, the biggest things that you think need to be focused on right now?
Yeah, for sure. I think one thing that is just tried and true is kids get nervous going back to school. And we see this every year, and it's been since I've started being a psychiatrist, right? It's like, fall comes, kids get anxious. It just is much more intense as of late, and I think families are struggling to understand which way to go. And so we've noticed that since the pandemic, kids' anxiety levels have gone up, and families are seeking more and more support, which is beautiful. But then the question is, how do I get that support? Where do I go?
And you work closely and are in the homes of, thousands of young children and new families. How important is that early childhood intervention? Because I know the state's been talking about a lot of expansion specifically to programs like Birth to 3.
Yeah, absolutely. Early childhood exposure to school and early childhood assessment of development is really crucial. If kids start into school and they've had no exposure whatsoever, by the time they get to first grade or kindergarten, oftentimes you see an increase in behavioral dysregulation and anxiety. In addition, if you can identify issues with development early on, you can provide the adequate support services necessary, or even just giving the parents the training necessary to help their kid develop at their own pace. That reduces anxiety in the child, and little kids express anxiety physically because they can't find the words.
So obviously that early intervention, super important, but you all are still there, even if that measure, hasn't been taken later on, in our conversations and, in public hearings at the state capitol, educators and providers have talked about what's stopping families and students from maybe getting that support they need. They've mentioned stigma, embarrassment, the need for teachers to be able to flag behaviors, and just kind of a general awareness of what is even out there, what is even an option for them. There are a lot of people who might be facing challenges they never had before, and so they don't know where to start. What is out there right now, and from what is currently available, what gaps do you see that need to be filled?
Yeah, here in Connecticut, we're fortunate in that we're trying to figure out a no wrong door option for families, meaning that you could present at the front steps of the Village. We have actual walk-in hours where you can get an assessment that day for your child, and begin the process of getting therapy and medications if necessary. There's that door. Then there's also mobile crisis, which is another door where you can call, literally dial 211. Get access to a clinician who can come out and do an assessment and provide support to your family. And then they have the urgent crisis centers, where there's actually like a physical location where you can go with your child, whether they're in crisis or not. They can come to the urgent crisis centers, and there are 3 in the community and 1 at Yale New Haven Hospital. One of the community ones is at the Village at 1680 Albany Avenue, and we're open from 7 a.m. to 11 p.m. Monday through Friday. You can walk through that door anytime during that period, even if your child's not in crisis, and say, hey, I just don't know what to do. I need help. Can you help me get resources? And that's what we do.
And what would you say to those who maybe think, I'm not sure if my child needs this, I don't know if this is the right step for me, I really don't know where to start? Obviously talking about all those great options, but for those who maybe not even know that they exist at all, or don't know if that's the right avenue for them, what would you say to those families?
I think it doesn't ever hurt to just ask for help and see and get guidance. And ultimately, it's your decision as the caregiver or the parent to decide whether that's the route you need to go. But honestly, I feel that the job that I and my colleagues play within mental health is not just to say, let's get you help, but also to help you understand what's normal and what's okay. And to be able to say, this is hard, but this is also natural and normal for your child. And how do you know what to do, and how do you know when things get to a place where they're not they're not within normal limits.
You mentioned those urgent crisis center, a new option for families instead of just going to the emergency room or a hospital for a mental health crisis. There are a few in the state here. You know, Fox 61 was there when funding for Hartford was secured, when the first ribbon was cut. Tell me about what that's accomplished so far. What's been learned now that it's been open for about a year?
Yeah, what we've learned is we went into it thinking we were just going to help families who were just in crisis. We
Right.
were hoping to divert those kids from going to the emergency department. We still really want to do that, and I think there's still a number of families who don't understand coming to the urgent crisis center is a place where you can go instead of the emergency department, where you don't have to be in a hospital setting, in a medicalized setting. Some hospitals in a hallway where your kid is expected to have privacy, but you can go into a much more comfortable, warm, and welcoming environment. So that's one piece that families still need to understand as an option. But the other thing we learned is families just come, and they may come. I've literally had families who are asking for support and understanding how to help their kids with just typical developmental milestones.
Sure.
And we literally can give guidance to them, give them resources that aren't necessarily clinical, but we can say, hey, this is how you can get some further help, but let's start here. And they actually walk out with a plan and some support services. If they're not in crisis, but they do need additional help, we get them referred to locations to be able to get them the right level of care. But that's all assessed through a multidisciplinary evaluation where you actually have folks that are clinical, nursing, psychiatry who get to see your kid right then and there. And that's a unique model. So we'd really span whatever you need, come on in and just ask.
Right. And so, you know, this support at all different levels, whether it's community initiatives, state policy, a lot of this comes from funding from various sources. And there are always people, though, who are pushing back on spending, whether it's at a federal level or a state level. The Village and other nonprofit agencies, schools, childcare centers have a lot of needs. You know, we talked about a lot of those today. It's always an ongoing conversation. As someone who's sitting with these families, with these kids in these classrooms, you know, what do you say, or what's the message you want those to know who maybe want to squeeze school spending or cut back on programs like the Village?
Yeah, I think, you know, there's always somewhere that needs the money, right?
Sure,
There's always
yeah.
another thing you can kind of funnel the money to. I think when you cut back from funding for children's programs, you actually don't just cut on what's happening today, but you cut on the future. And there's been a number of studies that demonstrate investment in early childhood has an impact at third grade achievement, as well as ultimately as an adult, how well people are able to sustain and maintain jobs. So this is like an investment in our future. So what we put in now actually reaps way more benefits and financially is better for the state long term.
And important resources for families to know about now as they get back to the classroom and for the rest of the school year. Dr. Taylor, thank you so much for taking a couple minutes. We really appreciate it.
I appreciate it as well. Thank you.
That does it for us here now on The Real Story. But if you want to watch these segments again, you can head to fox61.com or download the free Fox 61 News app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61 and streaming on Fox 61 Plus. Have a great morning.